How do you go from this? The public sector is full of people with sort of formal responsibilities to do things which, for all sorts of, the best of all possible reasons, don't get done.
Well, I think the first thing is to try and get everybody to agree that something needs to be done, and actually to find a point of common ground and point of common purpose upon which you can then start to build a piece of work which everybody feels they have some sense of ownership of, or some reason to be involved in it. I think quite often what happens is little initiatives start and people don't feel that they're fully engaged in it, or they feel it's somehow in competition with what they're trying to do, and then there's everything splits apart, and different projects go off in different directions and they don't have the impact. So for me, one of the most important things was to actually create this sense of common and shared responsibility to sort this out and to work on it together. Using the passion of that workshop, because it was really quite fueled with passion, and people felt very aware about what had been going on in the area, and the press at the time had been very significant. Fueled by that, people started to become interested in the idea that one could create a new vehicle for patients' voice that would move it outside of the system. So if you take the example that in that room there were 10 organisations, each doing their own thing, each with their own teams of public involvement people, each with their own departments for this, departments for that, none of whom were connecting, all of whom were operating in isolation. The vision was to say, actually, why don't we create something which is shared? The patient's experience is not separated out into 10 blocks of separate organisational contact. The patient's experience is one experience, and therefore to establish mechanisms to involve that person which is separated out makes no sense at all. The involvement mechanism needs to be fit to meet the needs of the person.
But presumably also stays with them over the entire journey rather than welcomes them and then is never seen again. Yeah,
it stays with them and it's theirs to own. I think one of the fundamental principles that we needed to create something that people felt was theirs. At the moment, systems for involving people belong to the systems.
Yeah.
And they don't feel that they belong to the people, they belong to the organisations. In a way, that in itself is sad, that the organisations aren't seen as being part of, a part of our world. They're seen as separate, but I think at the moment they are still seen as rather separate. But I think one of the principles was to create something which was outside of that, which sat firmly within the ownership of the communities and the people. That in itself was quite a challenging concept. However, we moved towards a situation where we floated the idea with those that were in a position to make it become a reality, or start the process to make it become a reality. And a very kind of passionate and dynamic local councillor in the area, along with the chief executive of the hospital, Mid-Staffs at the time, along with the chief executive of the commissioning organisation at the time and the Department of Health, saw the potential of an organisation that was run by people, for people, and that aimed to aspire to put the patient's voice in one place. The idea was that you create an organisation that can develop and build relationships with the public over a period of time. It becomes trusted by the public as being there for them and not for anybody else. And that it allows for relationships to develop in such a way where the public naturally engage with the organisation.
So it's not just with the patients, it's also with the carers, the relatives, all the people who might have some relationship to the patient.
Absolutely, and that it would engage with people in both what I would call a proactive way. I needs to go out and find out and talk to people and seek information.
Say hello to them.
Yeah, be proactive and engage and get things, but also in quite a reactive way in terms of what do we already know? How can this as an organisation be getting information from each of those 10 organisations that I mentioned, add that together to create a big picture. So at the moment, each of those 10 organisations has its own complaints department. The information doesn't cross-fertilise. So in each organisation, you may have exactly the same patterns, themes and trends emerging. But because they're not seen as a whole collective, the impact of them is not as strong.
And so what has happened since this has been set up?
So since it's been set up, we have an organisation which is now in existence. It's called Engaging Communities Staffordshire. It is a community interest company, so it operates as a social enterprise. That in itself is quite challenging, but it was seen to be the best way to create an organisation that ultimately would be totally independent. The idea of a social enterprise allows it to become funded by multiple funders, as opposed to being grant funded by one organisation.
And to have representation also from multiple stakeholders, presumably. Yeah.
And not to be seen to be serving the interests of one group or a small group or one organisation. It's often seen, one of the big criticisms of the organisations which are soon to be coming into place called Health Watch is that they are going to be funded initially by local authorities. So they will have one piece of funding and the Health Watch organisations will receive that funding. Part of their role is to scrutinise some of the work of local authorities, and many people are uncomfortable with that. The idea of having it as a social enterprise is so that over a period of time you can actually move towards multiple income streams, which means that you gain in independence rather than reduce your independence. So Engaging Communities Staffordshire exists as a community interest company, and in its first period of life, its set-up phase, all 10 organisations in Staffordshire contributed to the development of its creation and to its start-up and to getting it off the ground, and they are now customers of it. And the organisation does a number of things. One of the main things it does, and it's still in its very early days, is to gather insight and information from across all of those organisations to generate evidence about themes and trends and the things which appear
to be consistent. Yeah.
And to be able to do that in a way which isn't biased to one organisation or another, but sits in the middle and sits outside of those systems.
So how does that then relate to the hospital itself? Because presumably, let's say you develop a big picture and there's a problem in it. How is that then tackled with the hospital in question?
So there's a number of ways that would be tackled. So in its own right, Engaging Communities Staffordshire would be expected to raise those issues by making it very... The hospital itself is funding, is paying for part of the service. So it is paying for the ability of this new organisation to be able to take the information, make some sense of it and say, you really need to understand that there is an issue here. So on the one hand, it's a reciprocal relationship, and the organisation, the hospital is wanting now to be told and to be shown that things are not going well when they're not going well. So it's welcoming the opportunity to be shown that there are things, there are anomalies and there are things which are not right.
And at the sharp end, to be shown where the level of deaths in a particular area is higher than maybe might be expected?
Yes, although I think Engaging Communities Staffordshire in the model is more about relaying the qualitative stories rather than the data.
Yeah, so the hospitals remain responsible for
Absolutely.
the key management information, whereas actually what you're giving them is the patient information.
Absolutely, it's the information that they might not easily be able to get, and it's also system-wide information. It's about trying to move it away from it just being about a hospital. It's actually about the journey that a person takes through a number of different services as they go from being seen by GP to being referred into a hospital, then being discharged with the help of a social worker. It's very unusual for somebody to just use the services of one of the agencies in the area. So it's about trying to tell the story of the patient.